The three main stages of pregnancy. During pregnancy, the women are very curious about the different phases they are going to come across. Perhaps, it is surely very important to know about the main stages of pregnancy. There are three main stages. First trimester. The first trimester includes the first 13 weeks of the pregnancy. This stage is the most vital one among all the stages. In this stage, the baby would start developing the different important organs. Perhaps, there are a number of complications too in this stage for the mother as well as the child. One more very important thing is if you have the habit of smoking, you will have to quit it as it would be very harmful for the child. The same goes to the habit of alcohol. Alcohol is equally restricted at the time of pregnancy. All this quitting should be done in this stage itself. The first 13 weeks of the pregnancy cycle is regarded as the first trimester, and it's the most vital of all of the trimesters. It's this first trimester in which your baby will start developing all its critical organs, and it is the stage where the pregnancy can develop many complications too. If you are a smoker, it is advisable that you give up the habit right away, lest your smoking may descend as birth problems on your baby when it is born. Similarly, if you have a habit of consuming alcohol, you must stop it instantly, and you are also supposed to reduce your caffeine intake besides making sure a regular intake of essential vitamins and minerals. When it comes to the symptoms during your early pregnancy stages, you may get the classic morning sickness, frequent fatigue and urinating urge. Though all ladies are not going to get all of the symptoms, you don't need to panic if you don't exhibit all the symptoms the ordinary pregnant lady would show. Make sure to visit your doctor continually, and it is this trimester that you should learn how to look after you and your growing baby conscientiously. After the second 13 weeks, that's extending from 14th to 26th week of pregnancy, is commonly known as second trimester, and it is in this trimester that you will stop getting nausea. Further, you'll also start feeling the movement of your baby within your womb in this trimester, and you can also begin to get few discomforts in the shape of back stiffness and headaches. Your physical appearance will also improve to a great degree due to many hormone-triggered changes, and you may also put on weight and see your stomach bulging because of the expansion of your baby. Your baby's bones will also become harder in this trimester, and thus you need to continue to take all the prescribed vitamins and minerals without fail. Third trimester. The last and the final third pregnancy stages will again consist of 13 weeks, and it is in this stage that you're going to also start feeling concerned as the due date for delivery keeps approaching fast. If you can observe yourself closely, you can see your emotions getting mixed and anxious, and you will also start wondering about the assorted pros and cons of inclining a tender baby. In this third trimester, your fetus would have finished all its growth cycles and have grown into a full-fledged baby prepared to see the outer world, therefore making you contented and excited.